Hey guys, this is Charity Stanley, and this is the American Red Cross hospital disaster. This is the last component that's required for your disaster certification. Okay, so when we are talking about disasters, there's lots of different factors that are at play with disasters. So, big thing is that disasters can be lots of different forms. A disaster plan could be enacted for lots of rain. It could be enacted for hurricanes. It could be enacted for other countries, for tsunamis, for fires. Disaster could also be lack of water, or it could be ice, an ice storm, or snow. So disasters can also be medical disasters, like COVID was a disaster plan, was enacted when COVID started. And so there's lots of different disasters that you've got to be prepared for within the hospital environment. So the other components of the American Red Cross videos that you've been watching have been focused a lot more on the actual caring for people in shelter. And I'm a facilitator for the American Red Cross as well. With caring for people in shelter is a whole different set of skills that are required for caring for people in the emergent time before they can get to shelter. So frequently in a disaster, people have injuries or medical conditions that are require treatment urgently before they are safe to put in a shelter environment. So that's really what this last component is going to focus on, is looking at the hospital disaster plans and looking at how to respond to different forms of disaster that can happen within the community. So what is a disaster? A disaster, according to Merriam-Webster, is something that happens quickly. It's something that is really bad, and it's something that requires a special set of skills. And a hospital response to a disaster fits all of those. So, the Centers for Medicare and Medicaid Services in 2021 made some changes that hospitals must review disaster planning at least twice a year. So, they've got to look at what their plan is for disasters. The long-term care facilities must review them every year. And hospitals have to complete education and training for staff on different disasters that are common within their geographic area at least every year. Hospital staff also are required to do testing, and the testing can be different exercises. So, what we are going to be doing on the mass casualty day is an example of what a disaster exercise can look like. It's going to involve people who are working in different areas. They're all working together for the patient's good and for the quickest and best outcome for the largest number of people. Now, if we look at individual outcomes within a disaster, they may be negative. People will die in disasters. However, we are looking at, when a disaster approach is taken, achieving the best outcomes for the largest number of people. We have a couple of different types of disasters. We have natural disasters. A lot of these are going to be based from the weather. So we could have different types of storms. We could have lots of rain that causes flooding. We could have hurricanes. We could have tornadoes. There's a snowstorm. There's lots of different ways that disasters can happen naturally. We also could have a human generated disaster. This is going to be like 9/11, terrorist attack, sarin attacks on the subway. There's lots of different ways, driving a vehicle into a parade. that humans can cause disasters to happen as well. So we have different names for different types of disasters. We have an emergency. An emergency is going to be somebody that needs medical care quickly. An emergency is going to usually be isolated incidents. Okay, so it's going to be a person here, a person there. A multiple casualty incident would be a bad wreck on the interstate where we have 3 or 4 people potentially needing to be flown out. That would be a multiple casualty incident. Mass casualty, and casualty is another term for death. Okay. Mass casualty incidents are going to be large numbers of people that are either dead, critically injured, etc. Then we have mass fatality incidents. Mass fatality incidents are going to be where there's a larger number of dead than alive, and each of these present different challenges. So multiple casualty incidents do not exceed the capacity of local resources. Even if it is a bad wreck on the interstate and we have several people who are severely injured, we have multiple hospitals in the area. So in Knoxville, that would not be overwhelming to the local resources. If we were looking at further out hospitals, for instance, Cumberland Medical Center, a bad wreck on the interstate could overwhelm the local resources. And so that would become a mass casualty incident. So multiple casualty, local resources are okay. Mass casualty, they're overwhelmed and everything happens quickly, overwhelms local resources. Mass fatality incidents. This is large volumes of fatalities can overwhelm systems, and victims need to be recovered and stored for identification. One of the best examples of this is going to be with COVID. We were having lots and lots of people dying from COVID, and we had more people dying than the system was able to process. So we actually had refrigerated tractor trailers at the backs of hospitals to be able to keep people in a refrigerated unit so they could be buried appropriately and stored for identification later. So the disaster continuum, the way we prepare today for a potential disaster tomorrow is going to alter the impact that the disaster has on the community. Now, every disaster, every time we have a mass casualty incident or even multiple casualty incidents that stress the healthcare system, we learn something. We learn a better way to engage in these scenarios next time, because unfortunately, there will always be a next time. So we learned something, we better prepare. And as a result of that better preparation, better communication, the next mass casualty, the next multiple facility impact will be less. So we have several different phases in disaster management, first of which is going to be preparedness. Mitigation, this is going to be how can we affect early response? What do we need to be able to decrease the impact on the community at large? The response, how many people can we devote to this disaster? We may have to ask for other communities to bring equipment and bring manpower as well. What is our response like? How quickly can we get people there to help? Recovery and reconstruction, rebuilding. And then what can we learn from this and how can we better make changes today to improve the future response? So preparedness. Disasters are often unpredictable and they're quickly occurring. People need to know what you're expecting from them. So it's not just one of these old cartoons. Who's on first? Well, what do you mean who's on first? Well, who's on first? People need to know their roles, what's expected, and how to function. If you are not prepared, chaos can happen easily. Joint Commission has focused a lot of time and resources on ensuring that regional facilities and hospitals have committees on preparedness. And these committees look at improving ways of that people can communicate within the hospital, looking at how do we store our supplies? How do we make sure we have enough supplies? This was evident in the early days of COVID with people having to reuse N95 masks and trying to figure out other ways that we can keep the population safe. Looking at security, looking at utilities. Is our backup generator enough to be able to keep the things going within the facility that we need to keep going? And looking at clinical activities. How can we call large numbers of nurses in at one time to be able to better treat patients in the case of a disaster? So ways that we can improve our preparedness are going to be through educational events, through a functional exercise, through drills, through a full-scale event. So with what we're going to be doing is a full-scale event that you'll be participating in, and this is as close to a real disaster as possible. Mitigation. So the goal of this phase is not to prevent the disaster. The goal is to mitigate the loss, okay? Minimize the impact. What can we learn? How can we improve to decrease the effect of future disasters on life and property? Response. Look at our warnings, look at our evacuation systems, look at our ways to rescue. Do we have enough people trained in water rescue in a flood event? Or if we're looking at mountaintop rescue, do we have enough people trained in this specific type of rescue? Triaging of victims, providing care on scene, figuring out what is going on, how severe and widespread the damage is, and actions to support infrastructure. So during the fires in the Smoky Mountains, trees were down everywhere. With the trees down, it was difficult to bring emergency vehicles in. So they literally had to have chainsaws to be able to cut the trees up to allow the vehicles, the emergency vehicles, access to the points that they needed to be. The patient surge. Hospitals are required to treat anybody that comes seeking care from them. Now, this patient surge is going to require additional resources. It's going to require additional space, and it's going to require additional staff. Now, patients will be triaged based upon the severity of medical need. With this said, people will still come to the hospital for things that are not emergencies that could clearly wait until later, or that can be treated at home. So the ways that we will do triage within a casualty situation is we can do a regular triage. This is the simple triage and rapid transport system. Prioritize the victim's needs, or we can do a reverse triage. So the principle is the greatest good for the greatest number. Now, if it is your parent who is close to death, in most triage situations, the closer you are to death, the faster you get care. In a mass casualty situation, the closer you are to death, the resources will be limited. Okay, so you're wanting to do the greatest good for the greatest number of people. So disaster triage, do the greatest good for the greatest number. Non-disaster triage, the sickest are seen first. So a couple of different ways, the START system or the SALT system. So there's 4 colors of triage. Now, these are frequently with tags, and the tag will be torn off depending upon what level of triage they've received. So if the person's dead, there's nothing we can do to make them undead. So they don't require any care. We move on to the next. So immediate care, life-threatening, then they need help quickly. Delayed is going to be urgent care. I can put off transport up to an hour. I can put off care up to an hour. Minor injuries, I can put off care up to 3 hours. So the minor patients, first thing is, if you are injured in a minor way, you're assigned green. Get them out of the way. This makes the scene more manageable. You're going to send the patients who can get up and walk to a specific area. And that helps to give more room for emergency providers to be able to help the people who cannot get up and walk. So these patients are assigned green. They need to have care within 3 hours. So the next step is figuring out who is breathing good, who has a good pulse, and who is neurologically intact. So start with breathing. Respiratory rate greater than 30. They need immediate care because they're showing signs of shock. Less than 30, you're going to check for perfusion. If they're not breathing, they're dead. Move on to the next. For perfusion, you're going to check the radial pulse. If it is weak or irregular, you're going to tag immediate. If the radial pulse is present, then you move on to mental status. If you want to ask the patient to open their eyes, close their eyes, squeeze your hands. So the patients who do not follow commands are tagged immediate. The patients who can follow commands are in a better health situation, so they're tagged delayed. So you get the minor injuries away, okay? Then you're going to treat the patients the best that you can. And here is the SALT way of sorting patients. So it's really depends on your geographic area if you use the SALT or the SORT method. So again, black is for a patient who is not breathing. Red is for severe injuries, but they're still survivable. Gray, the patient is unlikely to survive given the available resources. So those patients will most likely go on to die. Yellow is a serious injury that's going to require treatment, but it can wait. And green are your walkie-talkies. So you have different zones. So your hot zone is the area that is the actual site of the disaster. Okay, so let's say that the disaster is a radiation disaster. Okay, so with a radiation disaster, the hot zone is where you are being filled with radiation. You're exposed to the radiation. You need to have on special gear with being exposed to radiation. The warm zone is where decontamination takes place and where triage takes place. We don't want a lot of people in the hot zone. People will go in the hot zone, pull other people out for decontamination and triage. The cold zone is where you are safe. Okay, there is no radiation. You are not close. This is where your in-depth triage takes place. Isolation and personal protective equipment. You may need to have a room that's a private room with negative pressure ventilation. This is what we use for TB rooms. So negative pressure rooms, when the door is open to the room, it will pull air from outside in the hallway into the room, and it will suck the air that's into the room outside through a separate ventilation system. And this allows the severe airborne bacteria to not enter the regular systemic circulation of the hospital. So that is air decontamination, and then PPE, making sure you have the right type of mask on for the bacteria, the virus, the fungus that you are working with. Recording victim data, this is primarily an EMS branch aspect. So this is going to be finding the initial complaint, interventions performed in the field if they have allergies, and medication history, basic assessment. Crowd control. People do not act in a normal way in a situation of a disaster. So crowd control is going to be the responsibility of security and the local police. So as a healthcare provider, you should not enter an unsecured area because you don't know what will happen with the crowd. Psychosocial needs of the patient, assess for individual needs, refer for follow-up. And common things that happen after a disaster is depression, difficulty concentrating, and difficulty sleeping. For evacuations, we have different types of evacuations. A horizontal evacuation is you are going to the same level on the same floor of the building, just a different wing. A vertical evacuation, you're on the 12th floor and you're trying to evacuate and get onto the lowest floor. Versus a shelter in place. With a shelter in place, it is too late to do any kind of evacuation strategies. You hold down the bunker and you're staying put. So that is a shelter in place. During the recovery aspects, you're going to want to repair and restore services, restock supplies, and figure out what equipment was damaged or lost and look at replacing that equipment. After disasters happen, people will start calling immediately their local facilities and looking for their loved ones. Even Facebook has gotten into that. I've been marked safe from the Gatlinburg fires, or I have been marked safe from whatever regional disaster is happening. So the family reunification is something that's very important. And you as a have loved ones as well. You would want to know when something happens to your loved one. We also, in addition to physiological injuries and medical needs, we have psychological triage. So disasters produce psychological issues in community members, healthcare providers, and people who have suffered through the actual disaster. This is really well documented since COVID, the role that the constant death and suffering that healthcare providers witness, the effect on their psychological state has been well documented. Evaluation phase. This is where we look at, this is what we did, this is what worked, this is what didn't work. Let's change it up. Let's find a better way to improve our response within the future. So the role of the nurse, you may be working as a first responder. You may be trying to identify and find resources, providing direct patient care. You may be assigned to a federal medical station, manage communications, Prepare yourself, your family, your friends, and your community for the disaster. And it's very important that you prepare your personal family for any kind of disaster, because you need to know that your family is safe. So you, as a nurse, can function and go help other people's families who may not be safe. So preparation is key. Educate yourself and understand about general adaptation syndrome and the way stress happens. You can go, 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 and you can work for so long until eventually your body says, stop it, stupid, and it forces you to stop. Roles of nurses working with victims of disasters. It begins with triage and assessing people based upon how severely they're injured. So there's a ton of different expertise that's needed based upon the type of disaster and the needs of the victim. So a person who has experienced third-degree burns is going to have an entirely different set of needs than a person that has been involved in a trauma from getting hit by a hurricane and different objects picked up by the winds. So the blunt force trauma. Local authorities will secure the area and figure out which zones are safe and which zones you can work within. You have to have special preparation and special consideration for people that you're working with special needs. So older adults, making sure that they have enough food and that they have water in case that the water systems are down. That patients with sensory speech issues, mobility problems, people who can't speak English well, making sure that these people have their needs met in a timely manner. So we have different effects from the disaster. It could be physical, short-term injuries, long-term injuries, could also be short-term exhaustion from working, could also be long-term effects, PTSD. Different types of disasters, again, natural versus human generated. Natural is going to be things that we have no control over. Okay, pandemics, tornadoes, wildfires. Here is an example of a tornado. These can also happen over areas of water. Those are called water spouts, but they tend to die out quicker than tornadoes, but they're pretty messy at the time. Physical effects to victims can be crush injuries, could be compartment syndrome. Things can be impaled. If an object is impaled, we leave it in place until we can take it out during surgery. Fractures, leave it in a position of comfort until you're able to actually set it. Could be brain injuries as well. Emotional. Tornadoes offer very little warning and can cause somebody to have nightmares related to the storm, to have chronic worry, trouble sleeping, and fear. Floods. Floods are very common in hurricanes. Emotional stress from hurricanes is going to be anxiety, worry, trouble sleeping, depression. So the next time that there's a hurricane or the next time the patient is exposed to sirens, these can act as trigger events and can cause them to have flashbacks to the original emotional situation. So it's important to be able to prepare, and it's important to be able to help to reestablish a sense of normalcy soon. Wildfires. This is the Gatlinburg wildfires. So emotional responses to fires is very similar to hurricanes. Can have the intrusive thoughts or the fears, worrying, absences because you're scared to leave home. Pandemics, COVID. pandemics usually are infrequent. They happen usually every 50 years or so. Prior to COVID, there was swine flu and avian flu. The most detrimental prior to COVID was the Spanish flu of 1918. Pandemics spread through a variety of vectors and fomites. Those are two words that you're going to need to know. A vector is something that is living that can transmit disease. So you and I as people coughing in the middle of the classroom, breathing on people can serve as vectors for disease spread. A mosquito can come bite John and then can come bite me and infect me with what John had. Okay, that is a vector, something that is alive that participates in disease transmission. This is in contrast to fomites. Fomites are going to be ways that we can pass diseases back and forth, but they are not alive. This is going to be elevator buttons. This is door handles. This is cell phones. This is a variety of different things, infectious body fluids. That's a fomite, okay? So variety of different vectors and fomites. COVID has had a huge impact upon mental health within the United States. And there's some common injuries that happen with, we're grouping the disasters now. With hurricanes and tornadoes, your previous comorbidities can be made worse. It can be difficult to get medications. You could have wounds from injuries. This body stress response can make all these diseases worse. Asphyxia from dust, from destruction, can cause difficulty breathing. Water and insect-borne diseases, animal bites, variety of different things. So common injuries, thunderstorms. If you are struck by lightning, it can affect your nerves, it can affect your muscles, and it can affect your blood vessels. Certain parts of your body are resistant to the electricity. That's going to be fat, helps make you resistant. Having rubber shoes on makes you resistant because then you are grounded, and bone. So if you are struck by lightning, that is a DC current. So that is a straight current for those of you that are science geeks, and it will put you into a systole. If you are shocked by a household voltage, AC current, that will put you into VTAC. Earthquakes and tsunamis, you have very similar types of injuries as a result of those. Snowstorms. Big thing that you will see with snowstorms, especially in areas that don't get a lot of snow, like Knoxville, you will see patients come in with heart attacks because they were trying to shovel their driveway when they haven't shoveled anything for a long period of time. So they've led a sedentary lifestyle, and all of a sudden they're going out and doing massive labor. So you're going to see injuries related to that. So biological weapons, smallpox is one thing. Now, the US and Russia both had smallpox stores, and the US's smallpox store is still safe in Atlanta, Georgia, at the Centers for Disease Control and Prevention. However, at the time that Russia fell, they had smallpox as well as a potential biological weapon. That smallpox has never been found, so it is unknown where or who in the world has that smallpox. So it's a way to make you feel nice and safe, huh? Now, anthrax is going to be anywhere where there is sheep, okay? Anthrax does not infect sheep. Sheep have learned how to coexist with it without becoming ill. But once the bacillus for anthrax is in the soil, that soil is forever contaminated. Now, the way that you can fix anthrax exposure is through dosing of Cipro or through doxycycline. And we do have antibiotic drug stockpiles, different places within the country. So the idea is these individual places, they want the antibiotic stockpiles to be within 4 hours of any major metropolitan area. So here in Knoxville, the closest antibiotic stockpile is located in Atlanta. And so they would bring up the stockpile of medicines to give it out to people as it needs to be given out. And then botulism could also be a toxin that could be used as a biological weapon as well. So human generated, this is going to be terrorism, shootings, mass violence, industrial accidents. So OSHA is very involved in recording accidents within the workplace. Active shooter, this is going to be somebody who brings a weapon into a workplace or into a school or into any location where there's a large number of people. And typically somebody with in an active shooter situation, they're trying to kill as many people as they can quickly, but knowing they will eventually be subdued or they will shoot themselves. Terrorism. Terrorism has occurred for decades. Most well known here in the US is 9/11, but we've frequently had bombing, shootings, people driving into a Christmas parade recently at Christmas. So terrorism can happen through conventional weapons, which would be like a gun. Non-conventional weapons had people who have stolen tanks and driven them down the interstate crushing cars. So that would be an example of a non-conventional weapon. Bioterrorism is using bacteria, viruses, or fungi to make people sick or contaminate the water supply. And then one here in this area that is well known is nuclear or radiologic terrorism. So if Y-12 was bombed, then it would have a nuclear release here within this area that would affect everyone. Types of disasters with common injuries. These are, I'll let you read those. You have explosives, you're going to have burns, you're going to have people losing limbs, penetrating injuries. The different types of injuries from trauma can either be from a blast, it can be from blunt force, or it can be from pressure. And so there's different mechanisms for each of those. So blast injuries tend to affect the face, places that are not covered. Respiratory, have difficulty breathing from the particles in the air. Frequently, your eardrums will rupture so you can't hear. Your digestive system may stop. The blast injury can also cause bleeding and circulation problems, and you may lose an extremity. Blunt injuries is going to be blunt force trauma to the head, to the torso. And one form of blunt injuries is going to be penetrating. So this is going to be where something is sticking out of a person. Pressure trauma cause the bowel to perforate, can cause the ears to perforate, can blow the lungs and cause them to perforate. Biological, radiological, and chemical injuries, nuclear detonation. The eyes can be burned from the bright light of flash of nuclear detonation, chemical burns, and radiation is a very nasty, slow way of dying. Radiation exposure damages the bone marrow and blood cells, damages the skin, damages the nerves, damages the neurons within the body. Incident command. So I'm going to go over this very briefly. Incident command is creating an organizational structure for the emergency management response. Now, we're going to go over this rather quickly, but incident command will be set up for any mass casualty event, and this is where the decisions are being made. When you're in a mass casualty event, use plain language and common terminology. Use terms that anybody, regardless of the education, can understand. Don't use radio codes, acronyms, or jargon because it can mean different things in different places. So, for instance, here in the Southeast, we call a stretcher a stretcher. In the Northeast, they call a stretcher a trolley. So, if I'm asking someone for a trolley, they may not understand because that is a regional jargon that isn't well known here. A hospital gown is also called a Johnny up Minnesota area. And so you've got to make sure that it's clear communication. So chain of command is going to be a top-down approach. So one person shares the ultimate responsibility. Unity of command is where everybody agrees and you decide that each person's input is needed. So hospitals have an incident command system, and they can very quickly mobilize people and stuff to be able to engage in an efficient response and enacting the emergency operations plan. So the hospitals here in Knoxville are all on a coalition with the health department for federal preparedness. And they do drills every now and then, every year or so, to help improve their community-based response. This is Hospital Incident Command System is part of the accreditation compliance now as well. So we have several different functions within a hospital incident management team, and these are different roles for how responsibilities are assigned. So command is the decision makers. They're color coded by white, finance, green for money, logistics, yellow. Logistics is going to be, hey, we need more masks. Where do we go get more masks? Operations is red and planning is blue. So the hospital incident commander is going to be in collaboration with the CNO, the safety officer, the public information officer, and so everybody is on the same page as to what is released to the community and ensuring that the staff stay on the same page as well. So the incident commander, again, is going to be partnered with the upper levels of the hospital organization, and the incident commander provides guidance to the chiefs that are below them for operations, planning, logistics, and finance. So each section chief their goal is to take care of that area. They want to organize and direct the different strategic resources, maintain a staging area if needed. What a staging area is someplace that is close enough to where the people are that need help, but far enough away that if, for instance, a fire happens, that we don't lose additional equipment. So that is what a staging area is. Now, here's an example of the way the operations section can be medical operations is medical. So the different people who are leading the different units. So you may have some patients who need behavioral health services. They would be referred to the behavioral health unit leader. You may have some people that need cardiovascular services. They would go to the cardiac unit. You may have some people that have penetrating wound and something rebar sticking out of their chest. they're going to need surgery. So you would refer them to the surgical unit, different aspects of medical care. Now, to keep the operating room going, we have to have power. We have to either be on a generator, we have to have water, we have to have air conditioning, we have to have oxygen. So that would be somebody who's taking care of infrastructure. Security was going to be dealing with crowd control. Hazmat, making sure that the people that are coming in have been decontaminated and are safe for us as hospital employees to treat. A coordinator to ensure that the families, as people are asking for information about their loved one, that they receive accurate and timely notification when their loved one has entered the facility. The planning section chief is going to gather, evaluate, and disseminate information, figure out a plan for mobilizing everything, and they're going to be tracking the resources. So if I need more individual resources, whether that resource be, I've got more people coming into this hospital than I have nurses to take care of them, they're going to be looking at how do we get more nurses here now? And that can be mobilized through different ways. Logistics is going to be, most importantly, food. If you are doing a long-term disaster response, then you are going to need to eat so you can continue to work. So logistics is going to organize food services. It's going to be doing the communication, getting the additional resources that you need, setting up the incident facilities, and then acquiring resources from internal and external sources. So at the beginning of COVID, there was problems with masks and the number of masks. So what they did was they looked around, okay, how can we access more hospital masks? And they would purchase as many masks as they could purchase. They also looked to the community, external sources. Hey, can you make masks and donate masks? And that was other ways that we could get different resources and get them mobilized quickly. Here's an example of the logistics section. So food services, making sure that people are getting time to sleep. We saw this with 9/11, that it is vital that the rescuers have people to relieve the rescuers so they can get some sleep. Otherwise, they were collapsing in the rubble. Now, unfortunately, money is how all this works. And so the green section, finance and admin, is responsible for figuring out the amount of time that people need to be compensated for, figuring out the cost, figuring out how they're going to do any kind of reimbursement, how are they going to pay for the food. And so that's the finance and admin section. Okay, so this is the last part for your American Red Cross disaster certification. If you have not already done so, please email your 3 disaster certificates from your previous online broadcast that you have watched. Email them to me so I can get these sent to the American Red Cross so you can get your certification to put on your resume. Thank you very much, guys. Bye.